Good afternoon, everyone. Welcome to this year's Black History Month webinar. We'll be talking about the Freedom House today. My name is Jocelyn. I'm from Heinz History Center. I'm joined with my colleague, Allison. Allison's going to be in the background, keeping an eye on the chat and Q&A box today, and I'll be walking you through this presentation. Just some ground rules. We will be using the Q&A box to take questions. So that's going to be at the bottom of your screen. And we'll also be using the chat function to take any comments or answers that you might have along this presentation. This is a webinar, so you can hear and see me, but I will not be able to hear or see any of you all. And yeah, so I'm going to start with sharing my screen. Give me a few seconds to get that all situated. All right, so welcome to the history and legacy of the Freedom House Ambulance Service. I'm so glad that all of you could join me today to talk about this amazing story that really highlights an important part of Pittsburgh's history. The Freedom House Ambulance Service was ahead of its time in the 60s. It really didn't just focus on transporting people to the hospital, they focused on giving their patients quality medical care before they even reach the hospital. With all this, we're talking about this idea of pre-hospital care that was happening back in the 60s. So for that, we have to talk about what type of care people were getting and how they were really accessing emergency care. So if we look back at 1968, 911 wasn't really a thing. People had to rely on calling their local private ambulance services, fire departments, or police departments. And many of the times, the vehicles that they were being transported in looked like what you see on the images you see on screen. So the back of them just had like these two flat stretchers, but you don't really see any equipment in the back of those. So during this time, it was really common for patients to be transported in the back of police cars with both police officers riding in the front. And this really left the patient unattended. Their goal was to transport patients to the hospital as quickly as possible. That means for the entirety of their travel, whether it's 3 minutes or 10 minutes, the patient wasn't receiving any type of medical attention. This issue was even worse in Black communities where private ambulance drivers often refused to go into those disadvantaged communities. And this was because of stigmas and fears, but all surrounding like this idea that these neighborhoods were considered dangerous. They were considered as people that didn't deserve to have this equal access to care. So it was all really based in racism. This left many people relying on police service to get some type of ambulance care. And this was really complicated because police, their main role was to uphold the law and uphold order. So these same individuals, police officers that you might see arresting your neighbors or in your neighborhood, are also the people you have to trust to transport you to the hospital safely. And this was a really tricky relationship to kind of navigate for people because a lot of individuals didn't trust police officers during this time. And some police officers didn't view Black individuals as deserving the same type of treatment as the white majority might get. So what we're looking at is really this huge gap in care between trauma event and when someone's receiving care, but also a race issue. So if we look at this quote that just popped up on the screen that says data is lacking on what's determined the number of individuals whose lives are lost or injuries are compounded by misguided attempts at rescue or first aid, absence of physicians at the scene of injury, unsuitable ambulances with inadequate equipment and untrained attendants, lack of traffic control, or lack of voice communication facilities. So what quote is talking about is something that we can all put under this idea of pre-hospital care. So pre-hospital care are medical services that are given for emergency purposes before arriving at the hospital. So anything that's happening to a person while they're in the care of an ambulance is considered pre-hospital care. It's in those moments that are really key. They can end up preventing someone having a serious disability happening to them or even death. So these things include CPR, use of devices like EKGs to monitor heart. And this is all something that we see today in most modern ambulances. Other things might include stabilizing broken bones or stopping the loss of blood. These are all things we know could save someone's life. And so if you look at this quote is really talking about this reduction in time. So reduction of time lag from receipt of injury. So when someone's being injured, whether it's in like a crash or a car accident, to initiation of medical care is one of the important elements in prevention of death or permanent disability in the combat zone. And although this quote is talking about wartime and in war zones, we can apply these same ideas to the streets of any United States city. The quicker someone is receiving care, the more likely they are to survive and come out of an event unharmed or be able to recover fully from an injury. So a lot of this information that medical professionals and politicians are getting during this time is coming from something called accidental death and disability, the neglected disease of modern society. It's a really long and extravagant title, and today it's mostly just called the White Paper. This was published in 1966 by the National Academy of Science. And it discussed this huge rise in something called accidental deaths. So this can be from injuries that are caused from car accidents, work accidents, or even falls. In this paper, we see a few different types of findings. One of them being that in 1965, there were 107,000 accidental deaths. So they included accidental deaths from car accidents, work accidents, and home accidents, all under this one category. And they even pointed out that seriously wounded individuals would have a better rate of survival in combat zones than in the United States. And that's because in these war zones and combat zones, they had this system set up to get care to the patient as quickly as possible. So they were doing it out in the field instead of waiting for them to get to a safe spot or somewhere away from it being busy. So this 44-page long report really focuses on the idea that pre-hospital care is life-saving and is something that needs to be standardized throughout the United States. Now, I know I just ran through a whole bunch of basic information around pre-hospital care and how people are getting care back in the 1960s. Were there any questions before I move on to the next section? And you can go ahead and use that Q&A box, or you can also put it in the chat.
I am not seeing any updates to the chat or to the Q&A box, but feel free to, if you have any questions at all during this presentation, feel free to use that Q&A feature or that chat box at any time. So we do have a question from Joe who asks, was the white paper nationwide?
Yeah, so the white paper was nationwide. It was written by the National Academy of Science. So that was a collection of scientists and doctors that were all gathering this information, studying it.
I think that's all of our questions for right now. But again, feel free to continue to put your questions in the Q&A box or in the chat, and we will stop periodically throughout the presentation to answer them.
Thank you so much, Allison. So we have this report, which was pretty much a call to action to create some type of system for trauma and pre-hospital care. But we have to remember that this is all happening in the 60s. So when you're thinking of the 60s as an era, what is going on during this time? What comes to your mind? You can go ahead and put those answers in the chat box. But as you think about that, I'm going to pop up some images on the screen.
I just realized I was talking without my microphone on. So we have a lot of things that are a lot of people saying things such as the Vietnam War, the Civil Rights Movement, segregation, the assassination of JFK, Martin Luther King Jr., Malcolm X, the Civil Rights Movement, social change, Reuben Carter, Dr. King. Lots and lots of really good Rosa Parks, counterculture, Ruby Bridges, the Cuban Missile Crisis, all really, really good things.
Yeah, those are all really great responses. They're all things that are contributing to the mindset of a lot of people during this time. When I think about the 60s, I really think about a nation that was really in turmoil. The civil rights movement was in full swing with people like Dr. Martin Luther King, Ruby Bridges, all these different civil rights leaders and change makers. We also have people protesting a very unpopular war, so the Vietnam War. So there's a lot of civic action and change happening throughout the nation, and people are really in that mindset of creating equal rights and making sure that everyone is getting adequate care and has access to a lot of different things. But on the other hand, there's also this advancement in technology that's happening, and that can be in transportation and also in medicine. So I want you to keep that in your mind as we move through and think about how these social issues are also affecting the Freedom House and its success or failure. We just spoke about the United States as a nation, but let's focus in on local Pittsburgh history and the challenges that we're seeing in the city. So Pittsburgh has these racial disparities. Black people and other people are fighting for equal employment and unions. They're fighting for equal housing and trying to desegregate certain places like swimming pools and things like that. They're just really striving for equal access to everyday necessities. Even if we remove the factor of race, Pittsburgh is still struggling with inadequate pre-hospital care that is compacted by the fact that pre-hospital care is being done by private ambulances and police ambulances that are ill-equipped, and the staffing of them are not trained to do emergency medical care. So they don't have the needs or the means to provide this life-saving service. The result of these challenges can really be seen when we talk about the death of David L. Lawrence. David L. Lawrence was the former mayor of Pittsburgh and governor of Pennsylvania, so a very influential politician. On November 4th, 1966, David L. Lawrence was at a political event at the Syria Mosque. So that's a building that was in Pittsburgh's Oakland neighborhood. There he suffered a heart attack. Luckily, there was a nurse in the audience that was able to begin CPR immediately. But when he was put in the back of the police ambulance, It didn't have any type of equipment that the nurse could use to help revive him. And it wasn't a stable environment. So as they were whipping around corners, the nurse wasn't able to continue to give CPR on him. The local hospital, so Presbyterian Hospital, was called by the assistant police superintendent to warn them that David L. Lawrence would be coming so that they were able to be prepared for his arrival. But when he arrived, he didn't have a pulse, and it took them 25 minutes to resuscitate him and get his pulse going again. So despite all of this, despite the immediate care of the nurse, despite being rushed immediately to the hospital being prepared for the arrival of David L. Lawrence, Peter Safford, the chief anesthesiologist, stated that David Lawrence was clinically dead. And so although he had a pulse and although that he had blood pumping through his body, he was basically brain dead. So he remained in a coma for 17 days and then he officially passed away then. The reason I'm telling this story is because this was a very important white politician who had all of the right things going for him when the incident happened. The immediate response, the rushing to the hospital, the care when he got to the hospital, and he still didn't survive. So we can only begin to get an idea of the lack of care Black citizens, especially those in poorer neighborhoods or disadvantaged neighborhoods, are given. Like there's a clear socioeconomic standard here where these poor neighborhoods don't have access to equal care or efficient care at all. So these are clearly some challenges that need to be addressed. In come 3 men. So the first one being Phil Hallen. He was one of those people that recognized these challenges and decided to take action. He was the president of something called the Maurice Fulk Medical Fund. So this was an organization that was really dedicated to providing funding and aid in medical and health-related issues. He was also a former ambulance driver, so he experienced firsthand the complete lack of care people got on their journey to the hospital. So he had this idea to create a private ambulance service, and he identified the neighborhood of the Hill District for that ambulance service to serve because he realized it was severely underserved and needed some type of help, medical help for their citizens. We also have a doctor named Peter Safford. So Safford himself was an anesthesiologist at the University of Pitt School of Medicine. He also worked at Presbyterian Hospital. And he was known as the father of CPR because he invented that life-saving technique. So Safford knew 2 things: that some type of standard needed to be created for emergency medical training. And he also knew that unskilled people could be trained to provide basic life-saving support. Now, this was a very uncommon belief among medical professionals, but it was something that Peter Safford was willing to pursue and willing to teach everyday individuals. And then we have this third man, James McCoy Jr. He was the founder of the Freedom House Enterprise Incorporated. This was an organization based in the Hill District that was created to benefit the economically and culturally disadvantaged. So what he wanted to do was really strengthen minority entrepreneurship, train people, and rehabilitate the unemployed and underemployed citizens in his community. So this was all about lifting up his community and giving them a better opportunity. So together, these 3 men had this idea. Phil Hallen was the one that proposed the idea and had access to funding. Dr. Peter Safford had the medical training and willingness to train others. And then James McCoy had this access to this vibrant community and people that needed this type of help. And together, their plan was to recruit uneducated and underemployed people, many of them African Americans, to provide medical training for them so they could run ambulance service to the Hill District and provide quality care to their community. So after all this planning, they ended up with the Freedom House Ambulance Service, which was a branch of the Freedom House Incorporated that James McCoy originally founded. And its mission was to provide emergency medical care and also provide training and employment opportunities for African-American citizens. I'm going to pause here before we move on because I know I'm talking about a lot of different things. And I just want to see if there's any questions that are happening in the background that I might be missing.
So feel free to ask any questions now in the chat box or in the Q&A. Could be about anything that we've talked about so far.
All right.
I'm not seeing anything quite yet, but if you have any questions at all, just feel free to post them.
Okay, great. Thank you. Just want to make sure I wasn't missing anything in the background happening. So we have this ambulance service that is being funded and put together called the Freedom House Ambulance Service. Their first training class began in 1967, and that training included classroom sessions, laboratory work, hospital rotations, and vehicle training. It was a really intense program that required a lot of focus. They were working side by side with other medical professionals to learn this trade. And the interesting thing about this first class is that their actual first experience in the street happened before they were even done with training. And this was following the assassination of Dr. Martin Luther King when riots broke out in the Hill District, so April of 1968. This was a really challenging thing for them to experience because if you see in this picture on the screen, this vehicle back here was actually an old police ambulance. So many of the rioters actually thought Freedom House ambulance workers were actually police, so that sometimes they ended up attacking the vehicles themselves. So what ended up happening was the Freedom House had to clearly identify that they were here just as medical service professionals and just wanted to help the citizens and make sure no one was getting severely injured. After that, they went right back to training and officially graduated in May 1968. And that's when they began the operation at a Presbyterian University hospital. In their first year of operation, the Freedom House Ambulance Service responded to more than 5,000 calls, with only 1.9% of their calls resulting in death while in their care. Over time, we really start to see this service developing to a whole network of people. So we had EMTs, so emergency medical technicians. Those would be the people giving care to people on the streets and operating the ambulances. We had dispatchers that would be answering calls and directing the Freedom House EMTs to whatever scene needed attention. And there was also just everyday staff, so the people that would help stock things, the people that help with administrative work. This was a whole production and it included a lot of different people. The training and organization of the Freedom House really created a standard that spread throughout the nation. It was a really great example for other people to follow.
We just have a couple of questions in the chat. I'm sorry to interrupt.
Oh, that's fine.
So most recently, and I think this would be something really easy, if you could just go back one slide. The scholars at PCA are asking when the Freedom Service began.
So the Freedom House Ambulance Service officially began in 1968. That's when their first class was graduated and able to go to the streets and work.
And then another question is, how did Hallen, Saffer, and McCoy meet and start working together?
How did they meet together?
Mm-hmm. Like how did they meet and start working together?
Yeah, so that's a really good idea. That's a really great question. So it all started with Hallen and having this idea to create a service. So what he naturally did is went to a hospital, so the Presbyterian hospital, and said like, hey, I have this really crazy idea. Like, I need some type of help, some type of medical training, some type of medical help from you all. And the person that he spoke to directed him to Peter Safford. So Peter Safford was a really unique individual. Like before all of this, he created CPR, which is something that anyone and everyone can do, and really it could save lives. So he already knew that it was possible to give life-saving care to individuals if you just have the proper training. Like his training for creating CPR was to expose someone to a paralytic, so something that would stop them from being able to use their muscles. And then he gave kids the opportunity to say like, hey, I need you to resuscitate this person. So I need you to pump air throughout their body. And that's like mouth to mouth and compressions. And it was successful. Like his crazy method of paralyzing someone and having a kid perform CPR worked. So it was only right that he continued this journey and try to figure out how to create different methods to save someone's life that were simple enough for everyday people to learn. And he knew that was something that could be done and should be done. And then James McCoy already had this organization established in the Hill that was working to uplift this African-American community through job training, through access to everyday materials. So if you already knew about that, you could go to them and say like, hey, I see you're doing this work already. Let's just take this in a little different direction by providing medical training and medical care. And because it was still targeted at helping people in the neighborhood and helping this disadvantaged group, James McCoy agreed, and all three of them came together, and out came this wonderful project called the Freedom House Ambulance Service. Long answer, but
that was perfect. And I think that's the only question that we have. So,
all right, great. All right. So they officially began operation in 1968. And the one thing that really set the Freedom House Ambulance Service apart from private or police ambulances were the vehicles that they were using. So this is an example that Peter Safford created of this idea model ambulance. In this, you can see they have these two beds or stretchers for patients to lay on and be housed, but there's also enough room for attendants to be in the back with the patients and be providing constant care to them. And off to the side, you also see medical equipment. So these be used whether it was to shock someone's heart or monitor it or even give them oxygen. So this was basically a mini hospital room. They had oxygen, burn kits, monitoring equipment, cardiac defibrillators, so all these things that could be used to save someone's life. So on top of being able to respond to emergency calls, they were also able to transport patients between hospitals while still monitoring them. So the Freedom House Ambulance Service began as an independent contractor for the city of Pittsburgh. The city's Department of Public Safety entered into agreement with the Freedom House Ambulance Service for them to take over service from the police district number 2. So that'd be right here, which would be the Hill District. This allowed the Hill District to have access to a private ambulance service and also allowed the police department to focus on their primary job, which is to uphold the law. As they continued and they started to have this small success and people saw that, their service area expanded to include downtown as well as Oakland. So what we're starting to see is really this idea of restructuring the police service to take out ambulance and emergency care and give that to someone else. Within the first few years of service, we can see the number of calls the Freedom House respond to increase drastically from starting at over 5,000 and going all the way up to over 8,000. So this was a really efficient service that people were using time and time again. There was even a study done by a doctor at Presbyterian Hospital that looked at inadequate care, but comparing inadequate care you might receive if you went with the Freedom House ambulance service, which was 11%, compared to a 60 to 80% of receiving inadequate care if you were to take a police ambulance, a private ambulance, or private car. So that was a huge gap in care and really showed how efficient and how ahead of their time Freedom House was compared to competitors. By 1975, they were demonstrating how they responded to accidents at this emergency and critical care conference. So different people from around the nation came to Pittsburgh and viewed how the Freedom House was responding to things. And they did this by having like a mock accident. So in this image, you see EMTs from the Freedom House pulling victims out of cars and stabilizing their legs. So this would be a volunteer. It wasn't something that actually happened, but it was a really good way to model what the Freedom House would do and what they were capable of doing. With growing success, they also faced setbacks and oppositions, and this was coming mostly from the city. So first, their funding was initially cut. It was cut in half from 100,000 all the way down to 5,000. And with this, they argued that they would no longer be able to service the downtown area. In this article, we see the city's response by saying that if downtown area is cut, it will be as well served by the police bureau, which gives each officer a week's course in first aid. And I like to point out just a little bit later in the article, we see this saying that they're rated, speaking about the Freedom House Ambulance Service EMTs, are rated by the American Society of Anesthesiology professionally as emergency medical technicians, having completed an extensive 32-week classroom course in-service instructions. So for them to say the quality of care would be the same with the police versus Freedom House is frankly untrue. A week's worth of first aid training is nothing compared to a 30-week intensive course. The next major setback that you can really see play out in the public is they were told to stop the use of sirens in downtown area. So an ambulance service whose job is to transport injured individuals to hospitals were told to not use their sirens. And this, of course, was a huge issue. If you were to see an ambulance today, you would hear their sirens and you would immediately pull to the side of the road and get out their way because their job is to transport patients as quickly as possible. These are really just ways to prevent the Freedom House from succeeding. And the city continued to put obstacles in their way of this mostly Black-run organization. But the Freedom House continued time and time again to overcome the adversities. The final blow really came in 1975 when the city of Pittsburgh revealed this plan for a city-operated ambulance service that would cover the entire city. And it would be part of the police bureau, so it would be run out of that. And it was called Pittsburgh Super Ambulance Plan. When this plan was revealed, immediately communities that were being served by the Freedom House voiced their concern. They said that the plan lacked empathy. So basically the city didn't really care for the people in those disadvantaged neighborhoods that the Freedom House was serving. And if this plan was to take effect, they would again be without adequate medical care. The community showed up for the Freedom House and fought for it to remain in operation. Unfortunately, they weren't successful, and we began to see the Freedom House shut down and hand power back over to the city. In our collections at the Heinz History Center, we actually have this document between the Freedom House and the city of Pittsburgh. And it kind of looks at how how service is going to be handed back to the city and these different promises each party is making. The Freedom House Enterprise Incorporation agreed to return to the city used vehicles. They also agreed to donate equipment and supplies. And they also were considering helping this transition of medical command. The Freedom House always wanted the city to be able to succeed in their plan because they didn't want their communities to suffer and they wanted everyone to have access to this emergency medical service. The city of Pittsburgh agreed to provide employment opportunities to all interested and qualified EMTs and dispatchers. They also promised to provide preferential assignments, so letting the EMTs and dispatchers decide what neighborhoods they wanted to serve or work out of. And they also promised to provide training opportunities for unqualified EMTs. So those would be people that weren't fully through the training course that the Freedom House provided when this transitional period happened. After speaking with the former Freedom House EMT, I know that every single one of the promises that the city made in this contract, they broke. And the sad thing about it is the EMTs didn't know that the city promised this, so they couldn't really fight back. They just kind of had to stick it out and work as hard as they could to be successful as a city EMT. I'm going to take a pause right here before I move on to the very last section and see if there were anything in the Q&A box or chat box I might have missed.
Thank you, Jocelyn. Just waiting on any Q&As. Again, if you have any questions about anything so far in this presentation, feel free to post them in the Q&A or in the chat box. We're happy to do our best to answer them for you.
I'll give a few seconds to get any questions down that I might have briefly covered that you want to explore more of. All right.
Doesn't look like there's any questions yet. So, but
great. I'm going to click onto this very last section. Maybe some questions will come in while we're talking about this. That's fine. So despite the ending of the Freedom House, we can still see the impact of it today. We can see it in people like Nancy Caroline, who was the medical director. She went on to write Emergency Care in the Streets. This was a training book used for all EMT training, and it's still used today. She also went halfway around the world and started an ambulance service in Israel. Another person we like to highlight is John Moon, who was one of those EMTs that successfully transitioned over to working for the city of Pittsburgh as a paramedic. And he continued his work for nearly 40 years. He ended up retiring as the assistant EMS chief in 2009. And then last but not least, we have Freedom House 2.0 that really continues this mission of the original Freedom House. So they give EMS training to young adults and people who lost their jobs during the COVID pandemic. And what they focus on is EMS care, but also community health work. So looking at chronic diseases and mental health work and how EMTs can aid community members in those that might be suffering from that. All right, I want to thank all of you for joining this presentation today. A recording of the webinar will be available online. And I also want to welcome you back next week for this webinar we have with John Moon, so the legacy of the Freedom House Ambulance Service. We'll be having a conversation with one of the former Freedom House EMT workers who I previously mentioned that ended up working for the city for a long period of time, and to hear his personal story about how all of this happened and went down. If you have any questions about what you learned today or questions about how you might register for next week's program, you can email me right down here. That's my email. And we'll also post a link to that registration in the chat.
Thank you so much, Jocelyn. Really well done today. Just a couple of questions from the chat. Did the Freedom House focus on giving medical attention specifically to Black communities, or was it for anyone who needed it?
That's a really interesting question. So it was created to serve disadvantaged neighborhoods, and that happened to be Black communities, but they did not say like, hey, we won't service you because you're not Black. There are definitely instances where you hear about the Freedom House going outside of their district, so Oakland, Hill District, and downtown, and going into more affluent neighborhoods such as Square Hill. So you do see them helping people of all different colors. And the interesting thing about that question is when this plan to create the Freedom House was put into action, a separate plan for citywide coverage was written, but for that plan to be executed, they would need so much more funding, and it wasn't something the city was interested in at the time. But they did want to provide that level and quality of care to everyone in the city of Pittsburgh, not just in the 3 districts they had access to or the right to cover.
Thank you for that. Another question from Kathleen, who asks, did the city shut down the Freedom House with the contract and use their own ambulances from then on? And there's also a second question, but I'll let you answer that one first.
Yeah, so in 1975, that's when they came up with that super ambulance plan that was going to be run out of the police bureau. And that is when Freedom House did shut down. So Freedom House's last day of operation was, I believe, October 17th, 1975. And the following day, the police took back over service to all the areas that the Freedom House was serving.
So follow up to that question, were Black communities given the same medical attention following the contract?
I don't have any stats on that, but I'm assuming not, just for the fact that there was still issues of racism in Pittsburgh and throughout the nation during this time. We have to keep in mind that when we're looking at systematic racism, we're looking at a system that is set up to not have certain communities succeed. And some of that is looking at how they're being served by public entities, whether it's the police or whether it's some form of government. So I can only assume, but I believe not.
Thank you. Another question from Penn Hills. Is it true that many police officers would rather have their family members transported by the Freedom House?
I'm not sure. That's a really great question. So I do know when I was speaking with John Moon that he would say that sometimes the police would arrive on the scene before the Freedom House and kind of race them to the scene. And they just had to watch as the police kind of pulled victims out of car crashes without really caring for their wounds. And it was something that was really hard for them because they knew the proper way to stabilize bodies and make sure that no further injury was happening. So I guess it depended on the person that you were asking.
Thank you. And also another plug for next week's John Moon talk. So if you have any of these questions that we're not necessarily able to answer, John Moon will be speaking about his experiences next week on Thursday at 1 p.m. So if you're wanting to attend that, that's also a free program. I'm just reading here. Somebody asks, would you say the Freedom House inspired the super ambulance plan? And was the Freedom House a pioneer in the industry?
Yeah, so the Freedom House was definitely a pioneer in the industry. They actually created a whole new job title, which would be EMT, which is Emergency Service Technician. I use them interchangeably, but there really is a difference between actually giving medical care at the scene of an injury versus just transporting someone to the hospital. So they did create that field of paramedicine or emergency medicine that we see today. As for if it inspired the police super ambulance plan, I feel like you could say that. I definitely feel like they created that plan in spite of the Freedom House. They said like, hey, there's this really great organization that's doing all of this work for these 3 smaller communities that were largely ignored. Like, what about the rest of the city? Like, it's not fair that only these small communities are getting access to that kind of service. So the city decided to create their own ambulance instead of just expanding the coverage of the Freedom House.
Thank you. And one of our last questions from Joe, who asks,
Allison,
go ahead.
Before you ask that question, I have one more other thing to add about inspiration versus creating in spite of. Another reason I say that it was more like a response to that is because when they transitioned into the citywide organization, they made it extremely hard for Freedom House EMTs to succeed under the city. So they put them in areas that they were unfamiliar with. They put them with teams that didn't necessarily accept them. So they systematically tried to get rid of the Freedom House EMTs when they transitioned to the city plan.
Thank you for that clarification. So another question again from someone in the chat. I lost my place. I'm so sorry. So was the shutdown of the Freedom House a graduated effort, or was it rather abrupt? And what was the last day of the operation again?
I believe the last day of operation was October 17th, 1975. It might be like the 15th. I might be a few days off. And it wasn't like super abrupt. Like, it wasn't, the city said, hey, we need you to shut down. They did know about this. They notified the EMTs and the workers of the Freedom House about this before it happened.
And I think our last question before we have to wrap up is from Penn Hills Cyber School. They ask, is it true Saffer lost a daughter due to dying on the way to the hospital, and that also led him to being on the board of the Freedom House Ambulance Project?
So Saffer did lose his child. I forget exactly what the cause was. I think she might have had asthma or something or other. And that led him to have this idea of creating some form or standard of care or pre-hospital care. So I do think that inspired him to do that work. I don't think it was directly related to saying like his daughter died and like a year later he joined the Freedom House. But I do feel like it was part of his identity and his mission to help with critical care.
All right, thank you so much. I think that's all we have time for today. But if you have any other last questions and that you didn't get to answer them or didn't get to ask them today, feel free to send us an email, drop us a line. We're happy to answer them. And of course, hope to see you all next week for our talk with John Moon.
Yeah, thank you so much. And if you have any other questions or have a specific question you want to ask John Moon that you want to get on my docket, you can go ahead and send me an email, or we also will be taking live questions in as well. Thank you so much.
Thank you. Have a great day.